And pre-surgery, so we're looking at your risk factors for MH. So anybody pediatrics under the age of 18 is actually a high risk. Anybody with any underlying muscle disease. So maybe even if they come back and we're doing a scoliosis case or strabismus case, some different things like that. So food for thought on that. It's not an elderly thing, it's more of a young thing. So during your history physical, that's what anesthesia is really looking at. I know those of us in the OR, we're also looking at that in their history and physicals. So food for thought if you do pre-surgery, to kind of like red flag, just making sure people are aware. The thing for recovery though is that maybe on some short cases or long cases, it could go either way. You might actually see the MH occur over on this side. So some of your actually early signs are going to be tachycardia. They're going to be profusely sweating everywhere, tachypnea, so things like that. The other things that are going to be early that you're not going to notice right away are like your metabolic acidosis. So those are going to be things where you're going to have to send off an ABG. But if you get a patient over here and they're really starting, they're pretty sweaty, we got tachycardia, maybe like 124, we're getting up there, and maybe the end-tidal CO2, do you guys have any way to monitor end-tidal CO2
Yes.
here? Okay, I would throw that on them. That's gonna be a telltale sign. That's 100% like, hey, if that's above 45, we need to start thinking that maybe this is MH. I know it's called malignant hyperthermia, but really the temperature part usually does not happen until later on. So that's confusing for people because we call it malignant hyperthermia.
Hello.
When in doubt, we have new posters. I will get the poster put up here. It will have the new M-House number. So if you're ever in doubt, you can call that number, tell them your signs and symptoms. Obviously, you're getting hold of anesthesia, but they're going to be able to walk you through it. Who you call on M-House is actually an anesthesia provider. So Dr. Scoop, that we all know, he actually sat on M-House, and he'd be one of those people that would answer those calls that come through. Do you know where the MH cart is? We have one for all of peri-op. With the main, it's over by OR2. If you need assistance, just yell out, somebody will go grab it. Grab this whole cart, bring it down. It's locked up just like your crash carts. Go ahead and unlock it. Because your first rule of thumb with MH is to get your dantrolene going. It's the only thing that's going to help it. There is a drug called Ryanodex. We do not carry it here. We only have the dantrolene. So you're going to have 10,000 50 ml syringes in here. Sterile water, it's already in here. There's 2 bags. I'm not going to pull it all out. And you're going to have 18 vials of dantrolene. So when you pull your dantrolene out, it's going to pull out of the box. It's going to be this lovely powder. When we mix it, it's going to turn to this clear. So I don't know if the camera can kind of see where that is. I have in here, you would take your sterile water and you're going to spike your bag. I have my generic one right here. It's already spiked. You're going to hook this up. You're going to quickly draw off 60 mLs. I know these syringes only go to 50. The hospital does not own 60s. So you're going to pull a little bit back. It does go past 50. It's the same size as a 60 ml syringe. It just says 50 on it. I know. There is hypos in here if you want to use them. There's also spikes. If you want to make it quick, you would take this, you'd go to your dantrolene, you'd shove it in, and it's going to start mixing for you. Oh my gosh, if I can get that going. This is pretty old and expired. It should be about 20 seconds. This might be a little bit longer. And then literally you're going to draw it up. And this is why you want like minimum 3 people doing this. Because this takes forever to do. So you're gonna have to draw it up and then literally take that syringe and hand it to anesthesia. It is a pain in the butt to mix this stuff. So literally 3 people, maybe 4 people, because when you hand this to anesthesia, they take it and they just slam it in. So it goes super fast.
And we're probably using like 8 or 10 vials.
You're gonna use a few. There's a cheat sheet in here. It does, so if you have your patient's weight, pounds, kilograms, it will have how many vials on average you could use. This is gonna be that 2.5 milligram per kilo dose. Now, you can go up to 10 milligrams per kilo. So if your patient is still having, the temperature's still up, maybe they're starting to have rhabdomyolysis, you're seeing the brown colored urine in the Foley bag, keep going with this. There's also a cheat sheet in here on how to mix. So there's no reason for you to memorize all this stuff. It's all in here. The one thing that recovery does not have that the other ORs do is a temp probe cable. So there is a temp probe cable, so you can plug that in here. And you have a temp probe Foley. So if the patient does not have a Foley catheter, or maybe they do, you can do like an esophageal temp probe, that's fine, but your bladder is gonna be your best core temperature for this. So that is why I recommend using that. There's more of the vented dispensing pins in here. So if you drop one, if you contaminate one, I have extra because these are amazing. And if you end up mixing a minimum of 20 vials, you're gonna need a few. This fourth drawer down has art line supplies, has central line supplies, because you're gonna need to be doing some internal monitoring. So the one thing with that though, is your patient by this point is so diaphoretic, no dressings are gonna stay. So you may notice even if they've come from surgery and they've got dressings, those are gonna start to slough off because they are so diaphoretic. One thing to help, if you can remember, is there is some Curlix rolls in here. This can also help to maintain an art line to wrap around it. The central line, don't choke them, but we found out you almost have to have somebody standing there holding it because it just will not stay on. Even, I can't remember what I was gonna say. You have some other, your cardiac drugs in here. You've got your sodium bicarbs, so if you do send off your ABG, you're probably a metabolic acidosis or respiratory acidosis. There is some bicarb in here. There's some there's calcium chloride in here. If you need insulin or anything else like that, that will all be in your AccuDose. With MH, it is, yes, that rapid, the end-tidal CO2, the temperature, but you're also going to have your underlying cardiac arrhythmias. So VTach is pretty common. We talked about the tachycardia. So just prepared, you might have to treat some arrhythmias. So you might need some amiodarone if they're in VTach or whatnot. But just remember, once you get this in and you treat the MH, all that other stuff goes away. You're gonna have to treat it, but just know this needs to continue until then. That kind of gets people, they're like, oh my gosh, now we're coding them. Keep going with this. You also don't want to get them too cold. You want to stop at about 38 degrees Celsius because then they're going to keep cooling down. The other thing is you guys are used to holding critical care patients. This patient would now be considered critical care. They're going to need a critical care bed, and they're going to need a dantrolene drip for 24 hours. So you need to call pharmacy, give them a heads up. We're going to need this drip before we transport over to a critical care unit. Could be ICU, could be SICU, it doesn't matter, kind of wherever you have a bed. Because the reoccurrence rate is about 20 to 25% within that first 24 hours. Questions? That was a very quick spiel on MH. And if anybody ever wants to go through this car or open it up, I'm more than happy to open it up and I'll go exchange it and whatnot. But sometimes it's just nice to see what's in there. There is a list on the outside of this card as to what's in here too. But you've got your dantrolene, you've got some of your cardiac meds, your acidosis meds, you've got your sterile water, your syringes. You should have everything in here that you need. Question?